Dear students, you're welcome to this session of today. Today we are going to start looking at gynecology, and basically we are going to look through, for this session, we are going to look at the introductory part, then we look at what exactly is contained in gynecology, then we shall go briefly to history taking, gynecological history taking. So my name is Kiden Robina, and I will be taking you through this. So gynecology refers to the study of diseases and conditions affecting the female reproductive system across a woman's lifetime. So at whatever age, if the female reproductive system is affected, be it infection, be it other conditions like cancer, all this falls under gynecology. So much as we look or we care for the woman throughout her lifetime, but there are some exceptional periods where the woman will not be under a gynecological care, and this is only during pregnancy, labor, and puerperium. Then also when carrying out tests like HPV testing, these ones do not fall under gynecology. These ones fall under obstetrics. So in most cases, in hospitals, actually, this department is put together, given the fact that it's all about a woman. So in most cases, it is obs and gyn, obstetrics and gynecology. So obstetrics looks at the normal part. Like for instance, pregnancy is normal, labor is normal, puerperium is normal. So this one falls under obstetrics. Then gynecology, when now things turn out to be abnormal, that is when now can be under gynecology. So common gynecological conditions can be categorized as follows. We have bleeding before 28 weeks of pregnancy, which can be caused by many other conditions or infections or factors. So this falls under gynecological conditions. Then we have gynecological conditions of the vulva, then gynecological conditions of the internal genitalium. So the female reproductive system is divided into two. We have the external system, then the internal. So the external is where we talk about the vulva. Then the internal contains from the vagina going upwards to the cervix until you reach to the ovaries. So let's look at gynecological nursing. Gynecological nursing is a specialized field of nursing focused on the care of women's reproductive health across their lifespan. So nurses in this field provide care for women with conditions affecting the vulva, vagina, uterus, ovaries, and the breast, as we mentioned before. So scope of gynecological nursing. Here we have menstrual disorders, and under menstrual disorders can be divided into dysmenorrhea, where the woman feels a lot of pain, and the other signs and symptoms may also include, but the main symptom is pain that the woman feels during menstruation. Then amenorrhea, when the woman ceases to go into her periods, does not go into her periods, and yet she is still in the reproductive age of 15 to 49, that we expect that she should be going into her periods. Then menorrhagia, when the woman has excessive kind of bleeding. Then the other score is pregnancy-related issues, especially pregnancy, miscarriage, and preterm labor. We also look at contraceptive care, where we look at education and management of different contraceptive methods. Then infections and STIs. Here we shall look at vaginal infections, pelvic inflammatory diseases, or what we can term as PID. Then cancers, cervical, ovarian, and uterine cancers. Then menopausal and postmenopausal care. This consists of symptom management and support during menopause, when the woman is ceasing to go into her periods, and postmenopausal after that period when she has ceased going into her periods. Gynecological patient care. Physical, emotional, and psychological support is required when giving gynecological care. Pre-operative and post-operative care for gynecological surgeries is very, very important. Ensuring patient privacy, respect, and comfort during sensitive exams and treatments is also important. So responsibilities of a gynecological nurse. The gynecological nurse needs to take thorough health histories and symptom assessments related to the reproductive system. Perform basic clinical examinations, for example, breast exams, abdominal exams. Then educate patients on reproductive health, contraception, menstrual health, and disease prevention. Discuss the implications of gynecological procedures, treatments, and lifestyle changes. Assist in performing routine gynecological exams, pap smears, and colposcopies. We continue with the responsibilities of a gynecological nurse. Should also provide comfort and care to patients undergoing minor surgeries and biopsies. Support women with conditions like fibroids, polycystic ovary syndrome, which is PCOS, endometriosis, and pelvic inflammatory disease, or PID. Provide care for women undergoing hysterectomy, laparoscopy, or other surgeries. Now, having done that, the next step is gynecological history taking. Like we mentioned above, that a nurse needs to be able or should be competent in taking thorough gynecological history. So in this case, let's look at this. So history taking in gynecology is crucial for diagnosing and managing female reproductive health conditions. A thorough history helps identify symptoms, risk factors, and potential diagnosis. Importance of gynecological history: helps in diagnosing conditions early, assists in planning effective treatment or interventions, enhances the quality of patient care by addressing both physical and emotional concerns. So as the nurse takes the history, there's a way the patient will react, and there are things that the nurse will be able to diagnose. So the nurse will be able to address them accordingly. Builds a strong patient-nurse relationship based on trust and understanding. So let us look at the detailed history taking. What are the steps that are involved? What is that the nurse should ask about? What exactly is required? What is that information that is important to us? So one is general history or personal data. This includes name, age, marital status, address, and the educational level. Then obstetrics history. This one includes the number of pregnancies and deliveries, and the nurse should go deep into the type of delivery that the mother underwent. Was it spontaneous vaginal delivery, vacuum delivery, or cesarean section. All this is important. Abnormalities during pregnancy, labor, or puerperium. Did the mother experience any condition that seems abnormal during that period of time? The number of children, ages, birth weights, and the conditions. Details of abortions, gestational age at which the abortions occurred, complications, and also causes related to the abortions. We still continue. The nurse now proceeds to looking at the menstrual history. So here, you need to ask the mother about the age of menarche. The age of menarche we refer to the first time that the woman saw her periods in her life. At what age was she when she went into her periods? This differs. Other people can go in from 13, 14, 15, but others as young as 12, even 10 can go into their periods. So research shows that the early the mother goes into her periods, the longer she is going to stay productive. When the mother goes into her periods early, she is likely to remain productive for a long period of time. Her menopause will come in later ages. And whereas people who delay to go into their periods, like those who go into their periods at 18, 20, they normally have a very short reproductive period. They also tend to go into their menopause early because they went into their periods very late. So the nurse also asks about cycle regularity, duration of bleeding, and the cycle length. Do the periods come regularly? How many days does the woman takes in her periods? And how often does it come? The cycle length. All these are very, very important. Then blood flow, the amount that comes out, then does it have clots, and which type of color? Is it bright colored? Is it dark? These are the things you can ask about. Vaginal discharge, amount, odor, itching, and whether there is any soreness around the vagina or in the vaginal area. Then the nurse will proceed to look at the sexual and the contraceptive history. Here, look at intercourse, dryness, intercourse. During the intercourse, when the woman is having sex, does she feel dry? Does she feel pain? What we refer to as dyspareunia. After the intercourse, does the woman have bleeding? What is referred to as post-coital bleeding? And how often does it happen? So all this you ask. Then contraceptives, ask about the type, duration of use, for how long the woman has been using that specific type of family planning. What are the side effects the woman is experiencing? For instance, bleeding, irregular cycles, and many others. Previous medical and surgical history, serious illnesses or surgeries, including deaths, outcomes, and treatments of those diseases. When did they occur? Diseases that led up to the woman being going into surgery, or it may not be necessarily that she went into surgery, but might have been a serious disease. When did it occur? and what were the kind of treatment and how did she recover? Did it leave any deformity on her as far as the reproductive system is concerned? For example, hysterectomy, which refers to the removal the of the uterus, or D and C if dilatation and curettage was done, and maybe it left her with some deformation. So all that is very important. Then we proceed to present complaints, and under this we look at the nature and duration of the symptoms current, the most present or the most current that the woman is complaining about. What is it about? What is the nature and what is the duration of symptoms? Then abnormal menstrual loss. Is there any abnormal menstrual loss? Like for instance, bleeding pattern, clothes, pain, specific local issues, that is pelvic pain. Does she have any pelvic pain? If yes, which site? What is the nature of the pain? Is it sharp pain? Is it throbbing pain? Is it burning kind of pain? Then also we look at aggravating factors. For example, which factors can make the pain worse? Is it when she stands? Is it when she lies down? Is it when she does work? Is it when she walks? So all those are very important. Vaginal discharge, what is the amount, the color, odor, presence of blood? Then pruritus, valvae or masses. Does she feel any masses around the vulval area, or does she have any itching around that area? All this is very important. Then we look at the family history. Chronic diseases like diabetes and hypertension, these tend to flow in the family. So does any of her close relative, did any of them suffer from this? If it is yes, then need to be noted very importantly. Then family cancer history, especially breast or gynecological cancers. Did any of them the family members suffer from this? This is very important. Other systems, like for instance, the bowel history, frequency, pain, constipation, diarrhea, blood in stool, and the color of the stool when she passes. Then urinary history. What is the frequency of urinary or of urination? Pain, does she feel any pain? Any urgency? Incontinence? Hematuria. Hematuria is presence of blood in urine. Color, then the odor. Then hormonal history, thyroid issues, voice changes. All these are very important. The changes in the voice of a woman says a lot. It is so much related with the type of hormone that the woman is having in the body. Then emotional problems, things to do with relationships, especially failed relationships, family dynamics, stress, depression, or anxiety. These are very important to note because in most cases, the emotional changes can also lead to changes in production of some of the hormones in the body, especially the sex hormones. Then we look at examination and documentation. So after taking all this history, the nurse needs to ensure that all aspects of the history are documented and clearly and accurately noted. So physical examination follows the history taking process and involves a pelvic exam, breast exam, and possibly imaging or laboratory tests. So after taking the history and identifying what the problem might be, then the nurse needs to do examination of the patient to rule out what he or she is suspecting. Communicate findings effectively for accurate diagnosis and management. So the communication of the findings should be very, very clear. Then in summary, we have looked at the gynecological history taken, and here we said the nurse needs to note the menstruation in terms of regularity, duration, and abnormalities, gynecological operations, past surgeries, and the outcomes, contraceptive history, types used, duration, side effects, sexual behavior, frequency, pain, or other concerns. So this brings us to the end of today's lecture. Thank you so much for being part of this.